in the area of health system resilience, particularly, we need to be very clear what are the absolutely vital services that must be able to carry on and build resilience into those. And one of my hats, I chair the board of the Partnership for Maternal, Newborn and Child Health. We are aghast at what happened with the disruption of services in the sexual and reproductive health area for women and girls. Contraceptive supplies not available, safe abortion not available where abortion should be available, lack of prenatal care, lack of safe birthing, lack of postnatal care, disruption to children's immunization. And then we could go on to the long list of people who couldn't get their essential therapies, their HIV antiretrovirals, their cancer drugs and urgent diagnoses. Our systems have to now have a very close look at how they prepare themselves to have service continuity, even in the most adverse of circumstances. There are things that just have to be done. They can't be left to falter while we're grappling with the pandemic. It's very important that the WHO is clear about what the benchmarks and targets are for preparedness and response mechanisms being in place. But clearly, a country like mine, New Zealand, will pay for it itself. High-income countries will. But there are a range of low and lower middle-income countries that frankly can't. Their budgets don't have that space. So in the panel's report, we look at solidarity funding. We propose a funding mechanism, which is basically a burden sharing one from each according to their means, to each according to their needs. And there's an estimate of, somewhere in the vicinity of up to 10 billion, perhaps a little more per annum, which would be needed to support preparedness activities in low and middle income countries. The message with respect to vaccines is that high income countries are going to be pretty lonely in our world if they vaccinate themselves and leave other countries largely unvaccinated. You cannot live a normal life in a high income country if all around you there are pockets, and they're very large pockets, of neglect because the solidarity funding didn't come forward to supply the vaccinations. So as long as we can't vaccinate the world comprehensively, we are all at risk. We also have a huge supply problem. It's not just distribution, chronic as that is, it's supply. The companies have not licensed enough manufacturers to produce these vaccines, and it's very urgent that they do so. We recommend in our report that WHO and WTO should be convening a meeting of the major vaccine producing countries and companies and crunching now an agreement on voluntary licensing and technology and knowledge transfer, which is needed to do the manufacturing. And we do support a TRIPS waiver, by the way. We think it's important and it's necessary.